Good morning, everyone, and thank you for joining us. My name is Patty Urena, and I am the Assistant Director of Education and Outreach here at Achieve a Family Trust. We're really happy that so many of you can join us this morning. We have over 200 people, over 240 people registered for this webinar. So this is a big one, and we're happy that so many people can join us both locally and from across the state. So I want to welcome you all and just go through a couple of housekeeping items first. First of all, I want to let you know that this webinar will be recorded and put on our website by the end of the week. So if you have to leave the webinar or want to go back and review it at some point, it will be on our website by the end of the week. And our website is www.achieveafamilytrust.org. So it'll be up there for you to review at your convenience. And please let any colleagues or friends or family members know that it will be available for them as well. We will have question and answer at the end of each session. So please use our Q&A box if you have any questions for the presentations. Our first presenter this morning is Erin Gay. Erin is a paralegal with the Pennsylvania Health Law Project, and she'll be going first. So at the end of her presentation, there will be time for Q&A before the next presenter goes. So if you have any questions, like I said, please feel free to put them in the Q&A box. And without that, I'd like to introduce Erin. She's a really good friend of Achieve a Family Trust and is always willing to do presentations for us and share her expertise and knowledge with the families we share. So Erin, I'm going to hand it over. Thank you.
Okay, thanks, Patty. Okay, can you see the PowerPoint, Patty?
Yes, I can, Erin. Thank you.
Okay, great. Okay, good morning, everyone. It's nice to be with you all. And I'm going to talk this morning about Medicaid in Pennsylvania. So we're going to talk about how people can get or keep Medicaid even when they work or start to work more or get promotions or get new jobs that pay a higher wage. So in case people aren't familiar with the Pennsylvania Health Law Project, just a quick overview. We are a specialty legal services program. We help people across the state of Pennsylvania. All of our services are free. We primarily help people with issues related to Medicaid, and we do some limited work with other public health insurance programs like CHIP or Medicare for low-income Medicaid beneficiaries. We operate a helpline, which is how people connect with us if they need help or advice. So people can call us or email us. We have an intake staff that will talk to the individual first, and then if the issue is something that we handle, then the person's case will be passed on to a case handler for further follow-up. Anybody can call us. So family members can call us, social workers, other professionals on behalf of somebody. And people can call us when they get denied Medicaid, or if they just have questions about eligibility or how a change in their circumstances might impact their continued eligibility, or if they're having trouble getting services through Medicaid or being denied services by Medicaid. Those are the types of situations we can help with. In addition to our client work, we do consumer education and outreach, so trainings like we're doing today. We have a bunch of resources on our website, fact sheets, videos, other consumer education material. We have a monthly newsletter that we email out to folks to update people about developments with Medicaid and other public health programs. And if you're not on our email list already, you can visit our website to sign up. And then we do systemic advocacy to improve the Medicaid program for people that rely on that important program. So with that, let's just talk about briefly what is Medicaid. So Medicaid is a big health program. It's kind of shared between the federal government and the states. So the federal government has broad rules that they set out that states have to follow, but then each state designs their own Medicaid program and tailors it to meet the needs of people in that state. So every state's Medicaid program is different, and the information I'm presenting today will focus on Pennsylvania's Medicaid program. So the Pennsylvania Department of Human Services is who administers Medicaid in Pennsylvania. And we call our Medicaid program medical assistance. So if you see medical assistance and Medicaid, they're talking about the same program. I'm going to just use the term Medicaid today because that's a little bit easier. Medicaid is a health insurance program for people typically who have limited incomes and often who have limited resources. And then people have to fit into certain groups that we're going to talk about. Medicaid can be somebody's only insurance, or it can be secondary or even someone's third insurance after, private insurance or Medicare. Medicaid always pays last. So any other coverage somebody has to be used before Medicaid would pay. Just some quick eligibility basics for Medicaid. People have to be a US citizen or a lawfully present immigrant. Immigrants typically have to be legal permanent residents and be in the US in that status for 5 years before they can qualify for Medicaid. In Pennsylvania, there are some exceptions. So if anybody has questions about immigrant eligibility, please contact our helpline and we can work through the situation. Somebody has to be considered a resident of Pennsylvania. So there's no minimum amount of time somebody has to live in Pennsylvania, but somebody does have to be present in Pennsylvania with the intent to remain here in order to meet the residency status. And then people have to fit into a covered group or category. And we're going to talk about some of those categories today. And then people have to meet the financial guidelines for that specific category. And again, Medicaid is income-based, and often there are resource requirements as well. But when Medicaid looks at income, they're generally looking at gross income. So income before any deductions are taken, but not all income counts. And we're going to talk a little bit about this because this is really important, especially for people that have earned income or wages from employment. And then for resources, Medicaid, when Medicaid looks at resources for eligibility, they're going to count resources that people can access. So they typically count bank accounts, retirement accounts, cash on hand if somebody has cash at their house, life insurance if there's a cash surrender value. But Medicaid will look at, again, what people can access. So if somebody has a retirement account, maybe they have an early withdrawal penalty. So Medicaid will factor in that early withdrawal penalty and only count the amount of that retirement account that somebody can access. Or if somebody has a job where they can't access that retirement account at all while they're working, Medicaid will take that into account. Same thing with life insurance. Again, if life insurance doesn't have a cash surrender value, then it likely won't be counted. If it does have a cash surrender value, then Medicaid may count some amount of that cash surrender value as a resource. Medicaid does not count as resources the following things. So the primary residence where somebody lives is not counted as a resource, regardless of the value of that primary residence. Medicaid will not count one car. They don't count things like irrevocable burial accounts or prepaid burial accounts. And if somebody has an ABLE account, we're going to hear more about the ABLE program a little bit later, but if somebody has an ABLE account, that's not a counted resource for Medicaid. Just some other basics about Medicaid. There are two benefit packages that people get based on the age of the individual who's on Medicaid. There's a children's benefit package for people under the age of 21, and then an adult benefit package for people that are 21 and older. Kids on Medicaid have really broad coverage. And essentially Medicaid has to cover any service that's medically necessary for a child. So there's a federal requirement known as EPSDT. It stands for Early Periodic Screening, Diagnosis, and Treatment that applies. And that's why Medicaid's coverage for children is broader than it is for adults. So kids on Medicaid can get home health services like home health aide care, ongoing shift nursing care, orthodontia services, and then certain behavioral health services. And then when the person turns 21, then some of that, the benefit package changes and they can no longer get some of the services that are only available to people under the age of 21. But even adults on Medicaid have a really robust set of benefits: physical health, mental health, substance use services, dental care, eye exams, prescription drugs, and more. Medicaid typically has low costs, low out-of-pocket costs when somebody has that coverage. There's no premium unless somebody's in the Medical Assistance for Workers with Disabilities program that we're going to talk about. When somebody gets services, there may not be any copays, but if there are copays, they're generally less than $4 a service. Children under the age of 18 don't have copays for any services. And then certain services or certain prescriptions might be exempt from copays. And then when people have Medicaid getting care, there are different delivery systems in Pennsylvania's Medicaid system. And most people in Medicaid in Pennsylvania are in a managed care plan. And that just means that the person has to follow that plan's rules to get care. They have to go to providers that are in the plan's network. They might have to get referrals to see certain specialists from their primary care doctor. They may have to get prior authorization for certain prescriptions or for certain tests or surgeries to be covered. And then some people are in fee-for-service Medicaid, which is just the access card, and they get their services through that system. And then in Pennsylvania, our behavioral health coverage is carved out. So physical health is separate from behavioral health services. And people always have a choice of their physical health coverage, but they don't have a choice of their behavioral health coverage. There's one behavioral health plan in each county, and people on Medicaid are in that behavioral health plan. So just again, for some context, kids on Medicaid, there's two different ways that kids on Medicaid or kids can qualify for Medicaid. One way is based on the family's income, and the income limits will vary based on how old the child is. Resources are never counted for kids to qualify for Medicaid. There's a link here, which I realize you probably don't get, but I can get a PDF of this PowerPoint to Patty, or I'll put it in the chat so people have access to this link, but it'll link to a fact sheet that has specific income figures for the different categories of Medicaid. Sorry about this. And then in Pennsylvania, we have a special category that allows children with special health care needs or disabilities to qualify for Medicaid regardless of their family's income. So this applies to people under the age of 18. Parental income has to be reported, but it's not counted when determining eligibility. And parental income has to be reported so that Medicaid can make sure the child doesn't qualify under the category for kids where an income limit would apply. Resources aren't counted. If somebody will have to provide information about the serious health condition or disability, and families are required to apply for SSI. Often this just involves a quick screening interview with Social Security over the phone. And oftentimes the income and resource situation of the family makes the child ineligible, and that's all that's required to meet that requirement. And then for children that don't qualify for Medicaid, Pennsylvania and other states have a children's health insurance program known as CHIP. To qualify, someone has to be under the age of 18, be a resident of Pennsylvania, meet some citizenship or immigration requirements, and the child has to be uninsured and not eligible for medical assistance. So someone cannot have any other insurance and be in the CHIP program. CHIP would be your only coverage. There are 3 levels of CHIP. There's free CHIP, low cost CHIP, and full cost CHIP. The free CHIP is typically available for families of 4 that have income less than $60,000 roughly a year. Low cost CHIP is eligible for a family of 4. The income limit would be about $88,000 a year. And then full cost CHIP would be available to people whose income is above that. People can apply online through Compass, by phone, or this website has paper applications that people can download and fill out and send to one of the insurers that are available in your county. And on this website, there is a link to the different CHIP insurers in each county in Pennsylvania. So now let's talk a little bit about Medicaid for adults in Pennsylvania. We're going to talk about some of these categories today, not all of them. So if somebody gets supplemental security income or SSI from the Social Security Administration, Pennsylvania is one of the states where SSI results in automatic Medicaid eligibility. Not every state has this automatic eligibility for people on SSI, but Pennsylvania does. So any amount of SSI automatically gets somebody Medicaid. They don't have to apply separately for the Medicaid benefits. And then sometimes there are special rules for people that lose SSI in certain situations that allow them to remain on Medicaid even after they lose their SSI. Just some quick examples. If somebody loses SSI based on their work and their earnings, Social Security might put them in a special program related to this, and they continue to qualify for Medicaid. If somebody loses SSI because a parent retires, becomes disabled, or passes away, and that kicks them off of SSI, there are special rules for that situation that allow people to possibly stay on Medicaid even after their SSI ends. Then there's a program of Medicaid called Healthy Horizons. And this is for people that are either older adults or younger people that have a disability or a health condition, serious health condition that's expected to last at least 12 months. If somebody's on Social Security disability benefits, they automatically meet the disability criteria. If they're not, then they have to, if they're not on Social Security disability, they'll have to provide documentation about their disabling health condition to the county assistance office. And they will be required to apply for SSI or SSDI benefits. And then they have to meet income and resource guidelines that are based on the household size. So some things to keep in mind for this category of eligibility is that if someone's working and earning money, only 1/2 of the gross wages will count toward the income limit. If people are working and have something called impairment related work expenses, which are expenses that someone with a disability has to pay in order to be able to work. And we're going to talk a little bit more about this in a couple minutes. But those can reduce somebody's countable income even more. At age 18, parental income and resources aren't counted. So oftentimes children that have been covered under that PH95 category for kids with disabilities where parental income isn't counted, they move to Healthy Horizons when they turn 18. Because parental income is no longer deemed for this category at age 18. And then resources aren't counted if somebody is under the age of 21, or if it's an adult with a disability who has young children in the household under age of 21, there's no resource limit in that situation. So these are the current income and resource limits for Healthy Horizons. It's 100% of the federal poverty level. These figures can change each year. Oftentimes they get updated in January or February when the federal poverty levels get announced. And again, these income and resource limits are after kind of any deductions are applied to income, or when certain resources might be taken out of the calculation when determining whether somebody meets these limits. Okay, the next program we're going to talk about is medical assistance for workers with disabilities. The acronym is MAWD. And this is a really important program for people. It's been around. I've been at the Health Law Project for almost 20 years, and MAWD has been around for that long and longer, but people still don't know about it. So we just want to make sure that we talk about this program because it can really help people, especially young adults who want to work and don't want to worry about losing their Medicaid benefit. So somebody has to be between the ages of 16 to 64 to qualify for the MAWD program. They have to meet disability criteria. So they have to be on Social Security disability, or they have to submit medical documentation about the fact that they have a serious health condition that's expected to last at least a year or is permanent. That the condition would limit their ability to work, but maybe they're getting medication or other treatment that helps keep their condition stable to allow them to work. The MAWD program does not require that somebody apply for SSI or SSDI. And I'm mentioning this because sometimes people on MAWD are told that they have to apply for Social Security benefits, and that's not the case. There is no requirement to apply for Social Security benefits to continue to get the MAWD program. Somebody does have to be working. You have to do at least 1 hour of work each month. There's no minimum work requirements beyond that, but you do have to be working. So even if somebody can only work, 4 or 5 hours a month, that's enough. That's enough to meet the work requirement. And informal work counts. So sometimes people are working for a company and they have paychecks. Other times people are doing informal work, maybe for a neighbor or a friend or even a family member, where they're helping, maybe babysit, helping do yard work or shovel snow, or helping, somebody with paperwork or paying their bills. Those sorts of jobs count. They just have to have verification. So if I was working for my neighbor, maybe babysitting a couple days a month, then my neighbor would write me a letter saying, Erin babysits for me 5 hours a month. I pay her X amount of dollars per hour to do the babysitting. That's the verification that would be needed. And then MAWD is the only program within Medicaid where somebody does have to pay a monthly premium. And the premium amount is calculated based on somebody's countable income after all deductions and disregards are taken. So just for an example, if I'm on MAWD and I'm working and I'm earning $2,000 a month, my only income is from my job. While my gross income is $2,000 a month, when Medicaid looks at my income and counts my income, they're only going to count about $1,000 worth of that income as my monthly income. So my premium is going to be based on the $1,000 rather than my $2,000 gross income. And we're going to walk through some examples at the end of the presentation that maybe you can clarify this. I apologize, my dogs are in the background, so if you're hearing weird noises, they're playing in the background here. These are the income and resource limits for the MAWD program. So it's 250% of the federal poverty level, which is currently $2,830 a month, roughly for a single person, about $3,800 a month for a married couple. The resource limit is $10,000 regardless of the household size. Again, some things to note: for earned income, only 1/2 of gross wages will count towards these income limits. And again, impairment-related work expenses may reduce the countable income further. Here for MAWD, resources are counted, even if the person seeking MAWD is under the age of 21, or if it's a person that has minor children under the age of 21. Resources are always counted for the MAWD program, and there is that $10,000 resource limit. Again, impairment-related work expenses, just some examples might be if somebody needs special transportation to get to and from work, then the cost of that transportation can be considered an impairment-related work expense. It's an expense somebody incurs to be able to get to their job. Another example might be the expenses of a service animal that somebody needs to help them be able to get to their job and do work at their job. Those are some examples of impairment-related work expenses that could be deducted. One thing I wanted to note is that MAWD will be expanding. There's a new category of MAWD that's been created called Workers with Job Success. This is the result of a law that was passed last year in 2021, the PA Act 69 of 2021. So the law took effect already, but it's not being fully implemented until the COVID public health emergency ends. And we're going to talk a little bit more about this, but right now, because we're in this COVID public health emergency that keeps getting extended by the federal government, most people on Medicaid cannot be taken off of Medicaid, even if their situation changes and they no longer meet the eligibility criteria. So because people, generally speaking, cannot lose Medicaid right now, that's why this new expansion is not being implemented. Pennsylvania is using this time to kind of get the details worked out so that when the public health emergency ends, likely sometime next year, that's when this program will be fully implemented and fully take effect. So to qualify for the MAWD expansion for this new category of MAWD, people still have to meet the criteria for MAWD. They have to be age 16 to 64, they have to be employed, they have to have a disability, and somebody has to have been in the MAWD program for 12 consecutive months before they're eligible to move to this new expanded category. So somebody that's not on MAWD at all right now can't get into this new category when it starts until they've been in MAWD for 12 consecutive months without a break. And it's for people that have been in MAWD and then their income goes up to the point where they would no longer meet the criteria for MAWD. This new program will have a higher income limit and help people maintain their Medicaid benefits while they're working more or taking higher paying jobs or taking those promotions. The premium will be a little bit higher. It's going to be a 7.5% premium as opposed to a 5% premium. Some people are going to pay a higher premium even beyond the 7.5%, but most folks that will move into this new category will pay about 7.5% of their countable income. And again, some details are still being worked out. So again, join our newsletter mailing list. We'll update folks as we know when this will be officially implemented. We have had some information about this expansion already in some newsletters, and there's a link to that in this slide. This is a really exciting opportunity. This is an effort that was led by people with disabilities who pushed for this, who did the legislative advocacy to find a sponsor for the bill, to get it passed through the legislature and ultimately signed by Governor Wolf. And it really will help people be able to take higher paying jobs, take those promotions, because a lot of times people with disabilities turn down jobs, turn down promotions because they fear losing their Medicaid benefits, especially their waiver benefits that we're going to talk about here. So this will hopefully allow or prevent that from happening. So again, just the main point of this slide is just if somebody has been on MAWD for the last 12 months without a break, they can start earning more money now, even though this expansion hasn't started. And whenever the public health emergency ends, they'll be moved to the Workers with Job Success program. Again, right now, the public health emergency has been officially extended by the federal government until mid-January. It's likely to be expected again until the spring. The federal government promised states 60 days notice prior to the end of the public health emergency. So if the public health emergency was going to end in the middle of January, the states would have received that notification by the middle of November. And there was no such communication. So that's why it's likely to be extended again. And then we'll know more early next year whether states get 60 days notice to prepare for the end of the public health emergency. Okay, just some more details about this expansion. The income limit will be 600% of the federal poverty level. So it's a really high income limit. This amounts to about $81,000 a year for a single person or $110,000 a year for a married couple. Again, the premium amount is going to depend on somebody's income. The county assistance office may look at adjusted gross income to determine where people fall on the premium scale and whether somebody will pay the 7.5% or pay the full cost premium, which is about $950 this year. We'll see what it gets adjusted to next year. And again, that's a lot of money. But again, this will help people be able to earn more money and stay on Medicaid and continue to get waiver services. One important piece to note about this new expansion is that after somebody moves to Workers with Job Success, they can accumulate resources above that $10,000 resource limit. These excess resources will be disregarded for as long as they stay in Workers with Job Success, or even if they move back to the regular MAWD program. So that's really exciting, but somebody can't have resources more than $10,000 before they move to the Workers with Job Success program. They have to be in Workers with Job Success before they can start to accumulate more resources and save more money that might put them above the $10,000 limit. The final thing just to note is that right before this new program was created, if somebody qualified for MAWD and also met the criteria for a waiver or Healthy Horizons, Medicaid was putting people into a non-MAWD category, mainly to avoid that premium liability. So even if somebody wanted to be in MAWD and they were eligible for some other category, they got that other category of Medicaid. But now, because the Workers with Job Success program requires somebody to be in MAWD for 12 months without a break, people will be able to say, I know I might be eligible for Healthy Horizons, but put me in MAWD. I'm going to pay the premium because I want to start earning earning months toward the 12 months that will allow me to move into Workers with Job Success. So people will be able to ask to be put in MAWD, even if they would qualify for a category that would not have a. Okay, and just again, to summarize what we don't know yet about this Workers with Job Success program, we don't know the exact start date. It all depends on the public health emergency and when that ends. The state has said that they, again, right now during the COVID public health emergency, maybe I have been on Medicaid, I started a job, that job puts me over the income limit for Healthy Horizons. Right now, I'm not being moved to MAWD because they're not moving people to MAWD and having people pay a premium during the COVID public health emergency. So they're trying to come up with a process for people that would be on MAWD, except for the public health emergency, to be able to credit those months toward the 12 months people need to be able to move into the Workers with Job Success. So the details of that process are still being worked out, but that's something that we'll be looking forward to understanding better in the new year. This is a complicated program with lots of nuances. It's a new program. So, it's less than clear how well caseworkers at the county assistance offices are going to know about this new program and understand all the nuances. And we don't yet know what the notices are going to say that people will get. So more to come on this, but we just wanted to make sure people were aware of it. And especially if somebody's been in the MAWD program for 12 months, they can start earning more money now, and they should be able to move to this program when it starts sometime likely next year. To apply for Medicaid, there's a number of ways to apply. People can apply at any time during the year. There's no open enrollment period for Medicaid like there is for Medicare or the marketplace. People can apply online, by phone, in person at the county assistance offices, or by mail. Everybody who applies should get a written notice of eligibility when their application is processed. If somebody is denied, that can always be appealed. And people should get a decision back within 30 to 45 days after they submit the application. When somebody gets on Medicaid, Medicaid will do renewals at least once a year, sometimes twice a year for folks on the MAWD program. Again, people on SSI, Medicaid's automatic. They don't have to do annual renewals. And then people on Medicaid have to report changes to their income situation, their resources, their address if they move, so that they can get the important notices that Medicaid sends out. And if there are changes to someone's household, those also have to be reported because that can affect the income limits that apply to the individual's situation. So I just wanted to talk about home and community-based services for a little bit, and then we'll take questions before going on to the next topic today. So home and community-based service waiver programs are Medicaid programs, and they're called waivers because the states ask the federal government to waive requirements that otherwise apply to Medicaid programs. And this allows waiver programs to be targeted to certain groups of people, like people with physical disabilities, people with developmental disabilities, people with intellectual disabilities, older adults. And it allows the waiver program to develop its own set of services to meet the needs of the people that are going to be served by that waiver program. And they're essentially alternatives to facility-based care. So these programs provide supports like assistive technology, shift nursing, personal care assistance, home adaptations, respite care, things that people with disabilities might need to help them live as independently as possible in the community and avoid having to get care in an institutional setting. This is often the primary source of support services like home health and shift nursing for people with disabilities after they turn 21. Again, they shift from the children's benefit package to the adult benefit package, and their Medicaid benefits become more limited. School services typically end at age 21. And these transitions can be challenging. So if somebody's facing this transition or needs help through it, that's another situation where somebody can contact us at the Health Law Project, and we can try to provide advocacy to help this transition go as smoothly as possible. Another thing to know about waiver programs, Medicaid is an entitlement program. So If somebody meets the criteria for Healthy Horizons, if somebody meets the criteria for MAWD, then they get into the Medicaid coverage and they get Medicaid benefits. The waiver programs are not entitlements. The ability to get into a waiver program depends on whether there are available slots. And for folks familiar with the intellectual disability waivers, know that there are more people that need services than available slots, and people can spend time on waiting lists, waiting for a slot to open before they're able to move into a waiver. There are some specific special eligibility rules that apply to waiver programs. There's a two-step eligibility process. The first step is clinical eligibility. There's a determination and assessment done to make sure somebody meets the level of care needed to qualify. Typically, again, this is an institutional level of care because it's an alternative to facility-based Medicaid. And then somebody, once they meet the clinical eligibility, then Medicaid looks at them under the specific financial eligibility guidelines for the waivers. The financial eligibility rules are the same regardless of what waiver program someone is trying to get into, but the clinical eligibility varies. And then once somebody gets into a waiver program, the specific services they get will be based on the individual's needs. So while a waiver program might offer 30 services, I might only get the 5 services that are helping me meet my needs and help me achieve my goals. So each individual person in a waiver gets a support plan or a service plan that outlines the needs, the goals, and the services put in place to help achieve those goals. So there's 2 systems of waiver programs in Pennsylvania right now. There's the Office of Developmental Program system for people with intellectual disabilities and adult and autism. And then there's the Office of Long-Term Living system that has primarily the Community Health Choices waiver. The OBRA waiver still exists. And then there's the LIFE program that kind of is an alternative to the Community Health Choices waiver. And it operates a little bit differently than all the other waiver programs. And again, for folks that have been around for a while, the Community Health Choices waiver program started back in 2018. It was phased in across the state, and it replaced waiver programs that used to exist, like the aging waiver, attendant care waiver, and independence or ComCare waiver. Again, these waiver programs differ state to state. So these are the programs that are available in Pennsylvania. And how people access them differs depending on which waiver program, which waiver system you're trying to access, which waiver program you're trying to access. People with physical disabilities, developmental disabilities, or older adults are going to start by contacting the independent enrollment broker, which is currently Maximus. Call a phone number, get that application process started. If people want to apply for a LIFE program, then they contact the individual LIFE program to start that process. For folks with intellectual disabilities, they're going to connect with their county's Office of Mental Health, Intellectual Disabilities, or maybe the Office of Developmental Programs at the county. This website will tell people what county office to connect with to kind of start that process. And on the intellectual disability side, even if somebody doesn't need services now, it's really important to connect with the county offices of the county office that kind of handles intellectual disability services, just to kind of help the county know the individual, know their family supports, and just kind of help people plan for the time when the person might need services. And there might be services available beyond, outside of the waiver system that can help people provide a limited amount of support. Okay, the financial eligibility for the waivers, there's an income limit that applies. Only the person who's applying for the waiver, it's only their income that gets looked at and counted. So even if somebody's married, a spouse's income does not count when Medicaid is looking at somebody for eligibility under a waiver program. There are no deductions or disregards from income. So if somebody's working and their gross income is $3,000, that gross income is what's going to be counted when Medicaid is looking at somebody for a waiver eligibility. There's not that same disregard that applies to earned income, that applies under Healthy Horizons or MAWD. The income limit changes each year, so this could change and likely will change for next year. But there is a special rule that if somebody meets the clinical criteria for a waiver, and maybe they're not financially eligible because their income is too high, if they meet the criteria for the MAWD program, that will help them get Medicaid and get onto the waiver program by using the MAWD financial eligibility criteria. And again, we're going to talk through an example about that. There's a resource limit of $8,000 for the waiver. It applies to people over the age of 21. There is a 5-year look back period that people have to provide resources for the last 5 years so that Medicaid can check to see if anybody transferred money or gave money away. Again, a house isn't counted, one car is not counted, able accounts aren't counted, prepaid burial accounts aren't counted. And there's some complicated spousal impoverishment rules that apply to married couples. And again, if people have specific questions about their individual situation, they can contact us at the Health Law Project and we can review that. If somebody's over the waiver income limit, again, MAWD is an option to help people qualify for Medicaid and the waiver. There's also a spend down option that might help somebody get below the income limit needed to qualify for a waiver. People that are over the age of 55 who get waiver services, there are estate recovery rules that apply, where after a person passes away, the state may try to recoup some of the money they spent on the home and community-based services care from a person's estate. And when somebody's applying for a waiver and gets, they're entitled to written notices, telling them whether they're approved or denied. And denials can be appealed, even if somebody is denied clinical eligibility or financial eligibility. Both of those denials can be appealed. And just know that the application process takes time. So oftentimes people seek these programs at the point where they need services. And that can be really challenging because it takes 2 to 3 months to get through the application process for those Office of Long-Term Living waiver programs. Again, on the ID side, there's the process takes time, but there's also waiting lists that apply. So just be mindful of the expended time frame to go through the application process for a waiver. So I just wanted to go through 2 examples quickly, and then I'll see if anybody has questions, which I'm sure people do. So the first example is somebody who's on a waiver and then who starts to work. So in this example, Ruth is on the Community Health Choices waiver. She gets $1,520 a month of Social Security disability, and she starts a job where she earns $2,265 a month gross earnings. So the waiver eligibility, the income limit, again, is that $2,500 income limit, and there are no income disregards for the Medicaid waiver eligibility category. So when you look at Ruth's income between her Social Security disability and her earnings from her job, she's well over the waiver income limit now. But because she has a disability, she's working, Medicaid can look at her and should look at her under the MAWD category. And again, on the face of the situation, her income of $3,700 is over the income limit for MAWD. But when you dig into the nuances and you see that her earnings are a certain amount, only half of her gross earnings will count toward that $2,800 limit. So after you kind of do those calculations and add her countable earnings to her disability income, then her countable income is below the MAWD income limit. So Ruth's able to keep her waiver, get on MAWD, and then she pays a monthly premium based on her countable income, which in this example would be about $130 a month. But that, again, helps her keep all of her waiver services and keep Medicaid, and allows her to keep getting those supports that are helping her live independently and be able to work this job. So that's one example. Another example is just somebody on MAWD who gets a promotion. So in this example, George has a disability, he's working full time, his only income is his earnings, and he earns about $60,000 a year. He gets a promotion where his earnings are going to increase to $75,000 a year, and George has been on the MAWD program for 2 years. So with his increased earnings, his countable income is going to be over the MAWD income limit unless George has some impairment related work expenses that could bring his countable income down. But again, after that earned income disregard gets factored in, then George will still be over the limit for MAWD, but because we're expanding MAWD and we're going to have this new category called workers with job success, George, who has been on MAWD for 2 years, is able to then transition to this new MAWD category, and he'll continue to get the MAWD benefits. His premium will increase though, because the new category has a higher premium responsibility. But the workers with job success will allow George to stay on Medicaid and keep getting those important benefits. So I know that's a lot of information. People can connect to us on social media. People can sign up for our newsletter to get updates, and our resource library has fact sheets and videos about a lot of the programs we talked about today and more. And then people can also reach out to us at the Health Law Project, our helpline, or if people have questions, you can call me or email me and I'll help you, or I'll direct you to someone else at the Health Law Project. So thank you for listening today, and I'll see if there are questions.
Thank you so much, Erin. I really appreciate it. And I do want to mention to everyone, I had put it in the chat box that I will be sending out everyone's PowerPoints in the next couple of days. So everyone in attendance, please watch out for those. And we do have some questions, Erin, so I'm going to go ahead and get to them. The first question is, does being in the MAWD program affect someone on consolidated waiver?
Somebody in the consolidated waiver would only need to be in the MAWD program if they didn't meet the financial criteria for the consolidated waiver, but people can have the consolidated waiver and MAWD.
Okay, great. Thank you, Erin. I hope that answers the question. Does MAWD count PA able as an asset for the resource limit?
Yeah, good question. No Medicaid programs that look at resources count able account as a resource. Those are excluded.
Correct.
So it's a really good program, and we're going to learn more about that. Yep.
Yes. How does the MAWD expansion impact eligibility to continue to receive SSDI and Medicare who have MAWD?
And that's a complicated situation. I think Joy may talk about some of this, but there are kind of some different rules based on earnings, that affect people's ability to keep getting their Social Security disability income. But even after somebody's disability payments end, if they still have their disabling condition, they're able to keep MAWD or Medicare for a number of years. So that's a nuanced question with probably different answers based on somebody's situation. So feel free to call me and we can talk through that more.
Thanks, Erin. If someone with IDD was automatically enrolled into community health choices, but would benefit more from the IDD waiver, what would be the process to transition?
Yeah, so if they, sometimes people with intellectual disabilities might go into community health choices because that's the system that serves dual eligibles who aren't getting services through the ID system. So if somebody is not getting any services through the ID system, the community health choices might just be their Medicaid coverage. And then at the time where they need waiver services, and they would go into an ID waiver, they would come out of community health choices for their Medicaid at that point. But if somebody is getting long-term services and supports, home and community-based services through CHC, but they might also be eligible for services through the ID system, then it comes down to kind of whether CHC is meeting their needs or not, because the ID system is all based on unmet needs, and that's kind of that PUNS system to determine kind of the unmet needs and where you get placed on a waiting list. If people are in CHC, their unmet needs might go down, and so it might delay their ability to get into an intellectual disability system. So there is some ability to move in between the two systems, but there's a lot of factors that come into play. But if it's just Medicaid through CHC, then whenever you need services through the ID system, that should be an easy switch, as opposed to somebody getting waiver services through CHC. That's a little bit more challenging.
Great.
Good
I find
questions. Yep.
these really are good questions. I find a common question is, what is the waiver income limit for each year? Is there a method to notify an individual or their support person what the waiver income limit is each year?
Yeah, it does change every year, and we probably know the amount because it's based on the federal benefit rate, the SSI federal benefit rate each year. It does get calculated. Medicaid should have updated information kind of in the long-term care handbook. I know we'll have an update on the when we update our resource that gives different income and resource limits. I don't know that there's a systematic way that they're telling people, though. I think that was your question, whether there's kind of an automatic way to know about whether the income limit has increased. And I don't know of any kind of systemic alert that goes out to people getting waivers about the increased income limit, unfortunately.
Someone asked if a recording of this webinar will be available. And yes, this webinar is being recorded and will be on our website by the end of the week. So please visit our website if you need to go back to it. Does the waiver program consider a $20,000 inheritance that was placed immediately into a PA-able and pooled trust as a resource for the look back period?
Yeah, probably not. Again, the ABLE account doesn't count as a resource. Oftentimes pooled trusts aren't counted because they're special needs trusts. The only nuance might be, I guess, if that would be considered a transfer for less than fair market value if it was put into the special needs trust, which I don't think is the case. So likely no, but that's probably worth checking into with either Achieve a Family Trust about the trust question or contact us at the Help Out Project.
And I do have my colleague, Maria Smith, is here. Maria, can you confirm that would not be counted as a resource for the look back period?
Funds that are transferred into a special needs trust they are a permitted transfer. So they are not considered, it would not be subject to the look back period. So
Thanks, Maria. And I just wanted to confirm that. And I'm assuming with that question, they did mention that it was split, because as of right now, you can only put up to $16,000 into an ABLE account per year. So I'm assuming that scenario was most of that money went to a PA ABLE, say 16,000, then another 4,000 into a pooled trust. So good question. Thank you. What happens after the age of 64 with MAWD?
Yeah, so after the age of 64, if somebody wouldn't meet the MAWD's not available once you turn 65. Medicaid should look to see if the person meets the eligibility criteria for any other category, like the waiver category or Healthy Horizons. If not, they will lose Medicaid. But at 65, people should have Medicare benefits. And so there will be coverage options available within the Medicare system, which may or may not meet everybody's needs, depending on what they're.
Next question. My son may work in another state for the summer and go to grad school in another state in the fall. Will this change anything?
Typically people are, if they're still considered to be a permanent resident of Pennsylvania, they intend to come back to Pennsylvania after these temporary absences for work or for school, then they're able to stay on Pennsylvania Medicaid because they're considered a Pennsylvania resident and intend to return to Pennsylvania after they're out of state.
Great. What age does MAWD help?
MAWD is for people ages 16 to 64.
If a person needs support to work, can MAWD cover the cost of the support person?
MAWD will not cover the support person, but MAWD could help somebody meet the financial criteria to get a waiver. Somebody would still have to go through that application process to see if somebody meets the clinical eligibility criteria. But MAWD is just going to provide Medicaid benefits, which don't include personal care assistance, attendant care, nursing. Those are only available through the waiver programs for people over 21.
What is the status of the AAW? There seems to be confusion hearing it being absorbed under ODP waivers.
Yeah, that's a good question. I think I'm a little bit confused about that too. So the AAW is the adult autism waiver. I think people still connect with the Bureau of Autism Services. It's now called something different as referenced on that slide. And I think there is some connection with the County Office of Intellectual Disabilities that might just help kind of keep track of where people are on that autism waiting list, since there's a waiting list for that program as well.
And someone asked the question, how do we learn about how to apply and open an ABLE account? Well, great news. We have someone from the Pennsylvania Treasury Department that will be speaking to that. Jesse Streeter will be coming up after Joy Smith, so he can tell you all about how to open and apply for an ABLE account. And then the last question, thank you, Erin, is if someone under HCBS or IDD or AAW without income and low assets is denied Medicare, Medicaid, or SSDI, would it generally be better to reapply or to appeal?
On the Medicaid side, I would suggest appealing. It depends on the reason for appeal or the reason for denial, but appealing, I would definitely suggest appealing the Medicaid decision or the waiver decision. And then hopefully Joy can address whether it's better to appeal the Social Security disability denial or start an application over. That's more of Joy's expertise than mine.
And you know what, Erin, one more question did pop up.
Sure.
For parents of teens, what would you recommend that we do now to help prepare our kids financially for adulthood?
Yeah, that's a good question. I think being knowledgeable about the different options under Medicaid for them to continue to qualify for benefits is important. And I think talking to resources like Achieve a Family Trust, maybe to help plan for resources, see what trust options are available based on your financial situation to kind of help plan for the future so that they can continue to keep their Medicaid benefits.
Thank you so much, Erin, and thank you everyone for all those good questions. I just wanted to add, to that last question about, in Erin's comment about reaching out to Achieve a Family Trust, please, for anyone listening, if you do want a little bit more detail about how we can help you prepare for the future, please reach out to us. We do a lot of programs throughout the year. We do a series of webinars like this, and we have done several in the past and plan to do some in 2023 on financial planning where, we can bring in other experts and talk to families about how to prepare financially your child, your young adult for the future. And I'll recommend and I'll suggest now that you sign up for our newsletter because that's where we promote all of our programs. And we do have some exciting ones planned for 2023. But a great start would be if you have any questions specific to your adult child, please reach out to us. So next up is, and again, thank you, Erin, for your presentation.
I'm sorry for the background noise.
Oh, no.
Sorry about the dogs. Bye.
No problem. I think everyone likes to see dogs. No worry. And so next up is Joy Smith from AHEAD, and I'll let her introduce herself and tell you guys a little bit about more what she's going to talk about. Go ahead, Joy.
All right. Well, good morning, everyone. Yes, my name is Joy Smith, and I'm from AHEAD. I'm going to share my screen here. Where'd it go? Share. This should. Hold on one second. I just had this up, and where did it go to? Oh, there we go. I didn't scroll down enough. All right, there we go. So can you see the PowerPoint?
It is up. Thank you.
All right, wonderful. I'll start here from the beginning. All right, so so I work for AHEAD, and what we provide is work incentive counseling. Some people call it benefits counseling. Basically, we're here to help people understand Social Security benefits, Medicare, medical assistance, and working. I will just answer that question that kind of segued into me. As far as do you appeal or start the process over, I would say appealing would be the first step if that's a possibility. If you're denied for Social Security benefits, there is a window of time that you have to appeal those decisions. So if you're out of that window, then you would have to start over. But I would always say to appeal would be the first step. All right, so here's my contact information. I'm what's known as a CWIC, a CWIC, and that stands for Community Work Incentive Coordinator. So we're trained by the Social Security Administration to provide this service to its beneficiaries. I am not an employee of Social Security, but we do receive all the training through Social Security. updates, ongoing training, what have you, is all from Social Security, so that we're well trained on their regulations. There's my email, and then our general 800 number, and you can do a go through the alphabet to get to mine. Joy Smith. Just a little bit about AHEAD, in case you're not familiar with our organization. We are a organization that serves people in the community with disabilities. We've been in existence since the 1970s. We have offices all throughout the state, and also go into other states as well with some programs. What our vision is to be the premier agent for creative, innovative pathways for employment and greater independence for people with disabilities. So we've been doing this a long time. We have a lot of experience in helping individuals, specifically with their Social Security benefits and working. I've actually been a CWIC since the program began back in 2001, so over 20 years now. And we've seen a lot of people come through, and a lot of successes, and a lot of questions being answered. So this is definitely something that I enjoy, and you know, it's great to see people being able to take those next steps, especially the transition age students. They learn all these great skills in high school and into college, and we want to, you know, extend that. Since we've begun this program way back when, we've always kind of wanted to change the goal of what people think and change some of the assumptions. I can't tell you how many times we receive calls and emails from individuals saying, well, how many hours can I work a week before I lose my benefits? Or how much can I make a month before I lose my medical assistance? And those are all questions that we do answer. But what we want to do is look at the big picture of this. You know, you want to work, all of us want to work to be better off financially. You know, whether that means you have a better apartment, you go on more vacations, you have whatever, you know, that's the goal of most individuals. So that's really what we want to talk to individuals about, is looking at the big picture. How is this going to impact your life? So when should benefits counseling occur? Here is a little snippet of some instances, but it's all relating to, do you have questions about Social Security benefits and working? You know, I want to work, but, you know, I don't know what's going to happen. Or I worked in the past and something happened to my Social Security benefits. They got all messed up. How do I report my earnings to Social Security? This is a critical part of the benefits counseling process that we offer. A lot of individuals think that if you're working somewhere and getting paid and taxes are being taken out, that Social Security is going to know that you're working and how much you're earning. They will eventually, but not in the time that they need to know. So it is really the beneficiary's responsibility to report their earnings to Social Security. And we talk to individuals about how that's done. That is critical. I often say when I do these presentations, you know, we give out so much information, it kind of, your head's swimming when all this is over. But keep, you know, key aspects of this in your head. And one of those is, if you do have any family members or yourself that are working and they're on Social Security benefits or medical assistance, what have you, they need to be reporting that to those entities. If they're not, they need to start sooner rather than later. So, you know, one of the other items we talk about too is, I want to work, but my mom's worried about what's going to happen to my benefits, or, you know, they heard that this is going to happen. We want to include as many people in the benefits counseling as possible. You know, grandma, whatever, who have you, supports coordinators, anyone's invited. You know, health insurance is so super critical. You know, tomorrow ends the Medicare open enrollment for this year. And, you know, a lot of people are trying to hurry to make sure they pick the right plan. And it's very stressful with this health insurance, because you need it, and you want to make sure that it works for you. I talk to individuals that say that they, have waiver, they can't lose their medical assistance, or they take, 5 or 6 prescriptions per month and, need that covered. What's going to happen to that when a person works? These are all things that we talk to individuals about. The next one is, it takes a long time to get benefits. There's a ton of paperwork they ask you to fill out, meetings, phone calls, more submissions of things. And a lot of times it's worrisome to say, well, I did all this work to get on these benefits. Now, what am I going to do? The last one there is, everything's going well for me now, but wonder if the job doesn't work out. We talk to people about that, planning for the future. I can't tell you how many times I talk to individuals and they say the exact same thing. Well, things are going good now, and I want to take the job, but what happens if in 3 months or 3 years from now, it's not going well? What am I going to do? Do I have to start all over again? In 2001, Social Security began this whole ticket to work program and benefits counseling. And the reason that they did that was because they realized that the beneficiaries did have barriers to employment. And a lot of these barriers are occurring from within. It is, when you get a letter from Social Security, they're usually at least 3 to 6 pages long. They're overwhelming. You start reading it and anxiety kicks in. So you need someone to help you understand what those letters mean. We frequently have our clients, email us scans of their letters or take pictures of it and send it through, text messaging, things like that. And we can look and see, okay, this is what you need to focus on. Don't worry about this right now, and those types of things. But it's overwhelming. So Social Security wanted to have separate agencies outside of the Social Security system itself to go over this with individuals. Like I said before, it's tough to qualify. There's a ton of wrong information out there. The most common one I hear is, well, you can work 20 hours a week and everything will be okay with your benefits. Or I can work part-time and everything will be okay with my benefits. That was never true, and that probably will never be true. And one of the factors that we're seeing now is the rates of pay that people are getting. It's unheard of what people are starting off making per hour, in entry-level positions. I have some individuals who are working in restaurants as dishwashers and things like that, and they're starting off at $15, $16 an hour. A few years ago, that would have been, maybe $8, $9, $10 an hour. So when you look at that and then take that times the hourly rate and the hours they're going to work, there's a lot of factors to look at. This stuff is not easy to figure out. That it's very complex information. Each benefit program has its own set of rules. SSDI, SSI, Medicare, Medicaid, food stamps, subsidized housing. We're not even going to get into those things today because that's another 2-hour presentation at the least. But it's tough. So you really do need to have a support system. And it's to a follow-up to one of the questions, what do you need to do to prepare? I think, attending these types of seminars. And I think it's something that needs to have repetition, because you're going to catch something today and maybe 6 months from now, you're going to catch something else, or you're going to need something else, or some of the rules are changing. So those are all important aspects. The last bullet point there is something called an overpayment. An overpayment is basically where the Social Security Administration has paid a person too much money. And when Social Security figures that out, they then want that money back. Hopefully, we do our best to try to minimize these overpayments by reporting earnings, keeping up with this stuff, being proactive with Social Security. But sometimes these things do, it can be thousands upon thousands of dollars. these are not good situations for the beneficiary, for Social Security, and for us as taxpayers, because essentially the government's paying too much money out and needs it, needs it to recoup this money. They are getting a lot better with these. When I first started doing benefits counseling, it wasn't unheard of to have, $80,000, $90,000 in overpayments. Now they're more reasonable. They're catching them quicker. But as the beneficiary or the representative payee, you need to be proactive as well. And we talk about that in benefits counseling. So the focus of this presentation today is mostly on SSI, and I do that because it's for transition age, and we see more of that age group on SSI rather than SSDI, but I will touch on SSDI points in a little bit. But to start off with SSI, SSI stands for Supplemental Security Income. It's low income, low resources program for elderly individuals with no disability status and adults and children with disabilities. So we got a picture of Nixon up there. So I put that there to just kind of demonstrate. This SSI was became law in 1972. So this year is the 50th anniversary of SSI. And most of the regulations that SSI has are based on 1972 rules, meaning they're very, very outdated. One of the items is the asset limit of $2,000. $2,000 in 1972 meant a whole lot more than it does here in 2022. They were intending to overhaul, update SSI this year for the 50th anniversary, but things got put on the back burner a little bit because of everything else that's happened, especially COVID. It kind of caused delays. I'm hoping that they will update some of these things, but because it definitely needs it. PA Able, which Jesse's going to talk about in a little bit, is a great way to be able to save money, and it doesn't count as that $2,000 asset limit, but you need to take those steps to set up that PA Able, because right now the SSI asset limit is still $2,000. I could talk all day about these limited assets. That it goes on forever. That's an application and continuously while you're on SSI. If for some reason you start accumulating more than $2,000 in assets that are counted, it could bump you off of SSI. It could bump you off of or medical assistance as well. The federal benefit rate for SSI for this year is $841. Next year, beginning January 1st, it is going up to $914 per month. I didn't get a chance to update my PowerPoint yet, but I do have my notes for the new amounts for next year. So the cost, that happened because of the cost of living adjustment. The cost of living adjustment for next year is actually 8.7%. That's the highest it's been in about 30 or 40 years. And we see that everywhere. We don't need to go into why that's happening, but that'll be the new amount for an SSI beneficiary next year, $914. Some people get a little bit more than that if they live in like a personal care home situation or a nursing home. Sometimes if someone is living with someone and they're not paying their fair share of the household expenses, they may get less than the $841, but it's generally around $841. In Pennsylvania, the Department of Human Services provides a state supplement of $22.10. So the federal benefit gives so much and the state gives another amount. And that's dependent on what state you live in. Here in Pennsylvania, if you're on SSI, you automatically receive Medicaid, medical assistance, MA, what have you. All means the same thing here in Pennsylvania. So you have this bundle of benefits, and then the questions comes up, what happens to each of these when I go to work? Before we're going to get into that, I'm going to talk a little bit about something called age 18 redetermination. This is critical because if you have a child who received SSI under the age of 18, they receive that under the childhood disability code. When that child turns 18, SSI has to move them and redetermine to see if they're still eligible as an adult. And this kind of throws some parents and families a little bit off, because you're thinking, well, they're still at home, they're still in school, nothing's really changed other than the fact that they turned 18. And that's all that needs to happen. It has, when they turn 18, they need to be moved into the adult criteria. This is something that Social Security will notify you of. They do this after the 18th birthday. You get a notice in the mail. Social Security really does everything via the mail. I mean, they don't email you stuff anymore, I shouldn't say, they never did. So you're going to be looking for letters in the mailbox. And you have to follow through with this. If you say, well, why are they doing this? This seems ridiculous because nothing's changed. You have to do it, or you become non-compliant and they'll terminate. But they do look at various things. They do look, is the child working? How much are they making? They look at, are they still in school? Is an IEP being done? So, there's a lot of different factors that Social Security looks at as this age 18 redetermination. Now, if they do it and they say, yes, John's approved, here you go, then then the work is done. But if for some reason they would say, you know what, John doesn't qualify anymore, we're not going to move him over to the adult status, then you can ask for something called a Section 301. And that basically says that they have to continue the benefits because he has an IEP. So they'll continue his SSI benefits while that IEP is in place. So if John, has an intellectual disability or autism, and he's going to stay in school till he's 21, as that IEP would be in place, he could potentially keep his SSI benefits until age 21. But you have to ask for this. You have to notify them, hey, he's in school. They're not going to know that. They're not going to know that John has an intellectual disability and they're just going to assume that he's still in school. You have to tell them these things. But this is a critical point. So just a little bit more on this. So when you have a child that's under the age of 18 and on SSI, they're looking to see how the disability affects that child in school. Once you hit age 18, they're going to look to see how that disability would affect him in the workforce. So if the criteria is not met, then I have seen some students be denied SSI. A lot of them can continue through Section 301. But you need to be aware of this. So talking a little bit about this great work incentive that Social Security has called Student Earned Income Exclusion. This is basically a way for a child on SSI to keep their SSI while they're in school and trying out these different jobs. So, they may be hooked up with OVR or with their high school, or get a job on their own, go to work at McDonald's or something. And, as kids, you try things out, we learn what we like, what we don't like. So this student earned income exclusion is Social Security's way of saying, hey, go do that and we won't touch your SSI check. Now, there are some limits to this. It's on the slide there. The monthly exclusion for this year is $2,040. So what that means is your child can go to work, make up to that amount a month at their job, and still keep their full SSI check. And then there's a yearly maximum of $8,230. So those are pretty high limits, even with the rates of pay we're seeing right now, because kids can only work so many hours, during the week. Maybe they just work in the summer, what have you. I will give you also the numbers for this incentive for next year. So for the monthly income, it's going to go up to $2,220 a month. And then the yearly amount is going up to $8,950. So this is a great work incentive for school age kids. So the criteria, you got to be less than 22 years old. Okay, so if you're still in college and you're 24, unfortunately, this doesn't apply to you. You have to be enrolled in school. You have to be on SSI and earning a paycheck. Once again, with this, you have to tell Social Security that you want this. You need to request it. They're not going to put 2 and 2 together to say, okay, John's 18, intellectual disability, he must still be in school, we'll give him this. Okay, you need to request it and show proof. So part of what we talked about earlier with reporting earnings, you have to do that on a monthly basis. So with the student earned income exclusion, what you would do is have copies of the child's pay stubs, have a letter from his school on their letterhead saying, John is currently enrolled in the 2022-2023 school year, wherever, and as actively attending. You make copies of that letter and the pay stubs and you mail them into the local Social Security office. And then they're going to put it in the system and say, okay, now John's working and he's applying for the student earned income exclusion. Every month you have to do that same procedure. Okay, you send in the letter from the school. Some parents put in a cover letter too, and we have examples of that. If you want to, it's not mandatory, but what is mandatory is the pay stubs and the letter from the school. Now, I've used the word a few times about being proactive. If you're sending stuff into Social Security and you're not getting any response, you're not getting a letter back saying, hey, we know John's working and he's going to qualify for this, or his SSI check is reduced, you have to be working with the local Social Security office to make sure they're processing what you're sending in. We, as benefits counselors, can work as liaisons with you and the local Social Security offices. We have contacts at each office where, Linda calls us up and says, hey, I've been sending these pay stubs for the past 2 months and the student earned income exclusion. I haven't heard anything from the, downtown Social Security office. We can make some calls in there to see what's going on. Has it been processed? Is it there? Are they, what's going on? But you can't just kind of, bury your head in the sand and say, well, I did this. It's all on them. You have to be proactive with this. Because at some point they're going to catch that he's working. And if you're not reporting it or following up with it, then they're going to say, what's going on here? Where are we at with all this? I can't say enough about this student earned income exclusion. There's so many kids that can benefit from this. And I think Aaron mentioned it earlier, MAWD's been around for a long time and still people don't know about it. The same thing for the student earned income exclusion. I talked to many, many families that could have used it a few years ago when their kids were students, but never knew it existed. And unfortunately, they don't really send out a blast or email or things like that to notify people. But this is wonderful for so many students to try it and see how it goes. This is only for SSI though. So if the student doesn't qualify for SSI, student earned income exclusion, let's say they're out of school, so they're 20, they just turned 22, they did all that great transition. Now what happens to the SSI benefits? So as I said earlier, SSI is a needs-based program. Generally, when you go to work, the SSI benefit is going to be reduced based on how much you're earning. I have a graph here that I've been using in presentations for years that kind of just shows you a synopsis of this and some examples. The first column there is the person's not working. They're just receiving the SSI. So they get $841. Second column, they go to work, they're starting to make $800 in the month. Now, this is gross earnings. Everything is looked at based on gross earnings. Even though they're making $800 at their job, they're still going to get $484 in SSI. And it just goes up the line there. You know, in column 5, they're working and making $1,300. They're still going to get $234 in SSI. So yes, the SSI is reduced, but when you look at the big picture, when you add the two numbers together, 1,300 and 234, they're still better off than what they were just with the SSI. So as you report the earnings on a monthly basis to Social Security, they're going to adjust the SSI check. So if he works more in the summer than he does in the school year, that's going to just adjust as you report the earnings. What generally happens is once you submit these earnings to Social Security, that's going to prompt them to send you a letter. And in that letter, it's going to say, okay, we know he's working and making $800. This is going to be his new SSI check. You're going to get one of those letters every time you report his earnings. One thing to comment on that, I was talking to a mom yesterday, and she's, you know, reporting earnings, doing what she's supposed to do, but her son moves around a little bit with jobs. He goes from one job to the next job, and that's fine to do, but you have to tell Social Security that one job ended. So like, let's say in August, he was working one place. If you don't tell them that he stopped that job, like this is the last month of pay stubs from that job, they could possibly think that he's still working there in November, because they have to close out each employment in order to start a new one. Sometimes they may think you're working a couple part-time jobs, and that's going to throw off these numbers. So what I suggest to individuals is if a job does end, you submit those pay stubs with a letter saying, hey, this is the last pay stub he's going to have from Giant Eagle. The job ended on this date. You could put in a reason why. He didn't like it, it didn't work out, what have you. But you have to let them know that he is no longer working there. And then, you know, in December, he gets another job at, I don't know, at a hotel doing something there. Then that's when you start reporting the earnings again. They're going to say, okay, John got a new job. Here he is. It's critical that you keep updated with Social Security. I think I say that a lot through this presentation. Now, oh, there we go. Now, there are some work incentives, additional ones. We already talked about the student earned income exclusion, but there's something called extended Medicaid coverage. So that's a great one as well for people on SSI. Even though their SSI benefit is going to be reduced, they still keep their medical coverage until they earn about $48,000 a year. That would even be before they need to go into MAWD. Now, this is only for SSI folks. But you don't have to worry about that Medicaid coverage changing while they're in that program. It's called 1619B. That's the regulation. There's also things called impairment-related work expenses. If you need to pay for things extra out of your pocket, so this would be something that's not covered under Medicaid or Waiver, you know, you're taking money out of your pocket to pay for transportation because you can't drive, but you take the bus or you take an Uber or a Lyft, that could be used as a deduction against your SSI. So instead of them saying, okay, Joy's making $800, they might only say, I'm making $600 each month because of my deductions for my transportation expenses. That's a popular one, transportation, and then any kind of medical related expenses. Most of the time it's all covered under Medicaid, but if you do have some, it might be worthwhile to look into. The other one that I'm seeing more and more is service animals. So, you know, you have a dog, And that helps you with a variety of things. That can be used as a deduction as well. Now you might not be taking the dog to work, but you do use it at home to relax from your day of work or get you ready for the day of work. I have several people that are using the expenses for the animal as deductions. And you do have to have receipts for everything. But I have one gentleman, and he, the dog food, the vet bills, grooming, all that's all can be used as a deduction. There's also something called a plan for achieving self-support. That's a PASS plan. That's when you want to have a vocational goal and you need money for that vocational goal. It's super specific. It is very helpful for people that fall into this category, but it's a way for Social Security to allow you to save money for these vocational goals. And then, of course, PA able. I'm not going to talk about that right now because we do have a presenter and I have to watch my time because I could go on for hours. Before I get into reporting earnings, I'm going to do maybe a minute on SSDI. SSDI is Social Security Disability Insurance, and that is also for a person with a disability, but you qualify for that if you've worked and paid into the system, or if you're younger, maybe mom or dad worked and paid into the system, and one of three things have happened to mom and dad. They've either passed away, they're collecting SSDI on their own, or they're retirement age and collecting Social Security benefits. So it's a whole different group of individuals. We don't see that too much in transition age, but for SSDI, you have something called a 9-month trial work period where you can go to work, make as much money as you want, and still keep your benefits. The amount for the trial work period for next year is $1,050 gross per month. The amount for the next step with SSDI is something called substantial gainful activity. And that amount is going up to $1,470 gross per month next year. So they have a very specific, they don't do a calculation. SSDI is really an all or nothing program. Some people say to me, which one is better? I mean, it's 6 of one, half dozen of the other sometimes. But whenever we do benefits counseling on individuals, we focus it on the benefit that they're currently receiving. There are about 4 different methods of sending in or reporting your earnings. You can do telephone reporting, and that's not calling in the local office and reporting it. There's a special number you call in and report on the smartphone. Now they do have an app that you can report your earnings. There's a way to do it through Social Security's website. And if you can't do one of those 3 things, you fail or fax or mail it into the local Social Security office. I will say this, if you're applying for a student or an income exclusion or have any of those IRWI deductions, you have to use the last one. The other 3 methods don't support those types of deductions and different incentives. I am running close on time here. And I want to leave a couple minutes for questions, but what we gather for each person that we provide benefits counseling to is something called a BPQY. And it's basically a snapshot of the person's benefits. It tells us about their when they started receiving benefits, how much they're receiving, any work incentives they've used in the past. I'm going to skip ahead to this because this is an example of a BPQY. It may look like it's hard to read, but it provides us with a wealth of information. So if anyone is thinking about having benefits counseling done for your family member or yourself, I would encourage you to try to get one of these. And the way you can do that is you can contact the Social Security Administration. I would call their 800 number, the national number. Wait till you get to a representative, let them know you're on Social Security benefits and you want to work and you need a copy of the BPQY. They will mail it to your home address. It is free. You do not have to pay for it. If you run into trouble getting this from the 800 number, once you do get to an actual benefits counselor, we can assist you in getting this. But this honestly does speed up the process if you come to us with the BPQY. So how do you get to me and what do I do? So I work under a contract with the Social Security Administration called WIPA, Work Incentive Planning and Assistance Program. And it's a cooperative agreement. There are 4 WIPA providers here in Pennsylvania, AHEAD, Appalachian Regional, Disability Rights of PA, and Full Circle. All contractors have to have national certification, and we need to maintain that. So it's critical that we're up to date on all the new regs that are coming out and anything new that we need to keep abreast of. So who's eligible for work incentive counseling? You have to be on Social Security benefits. You cannot be in the application or the appeal process. So if you're already on Social Security benefits and 14 years or up to full retirement age, Social Security wants us to work with transition age kids. So if you have a 14-year-old and they're not working yet, but they want to work, they're eligible for the program if they're already on SSI or SSDI. This is something that Social Security feels strongly about because, like I said earlier, there's so many great things going on with transition. We want to utilize that as much as we can. There's some prioritization under WIPA. Obviously, there's a lot of beneficiaries out there that need this service. We try to serve as much as we can, but we do have priorities. Individuals who are working or actively seeking employment, or if you're transition age, 14 through the age of 25, you're automatically eligible for WIPA if you're on benefits. So how to get to a benefits counselor? Back in the day, people would pass out my number and say, hey, call Joy, or I heard AHEAD does this, or what have you. But really what we want to see happen now is, and this is a mandate through Social Security, through our contract, is you need to call the Ticket to Work helpline number. And I'm going to run through these in just verbiage, but I do want to put the helpline number up here. You want to call this number. This is not Social Security. It is a separate helpline. And this is for Ticket to Work, but this is how you get to a benefits counselor. When you call, you want to have the beneficiary and the rep payee, mom or dad, whomever, on the call. And you're going to start off by saying, hey, I have questions about working and my SSI benefits. They're going to ask you some general questions, and they're going to be able to get into Social Security's computer system a little bit to see, okay, yeah, John's on SSI. We can make this referral. They're going to ask you, do you want to be referred to a local WIPA provider? You're going to say yes. Then they're going to take down some more information, and that referral is going to come from the helpline directly to me if you're in our service area. And then if you're in Appalachian Regional or Full Circle, it'll go to their project directors. Once we receive that referral, we reach out to you and we start the conversation. What's going on? What do you have questions on? And the benefits process has begun. Benefits consultation process has begun, I should say. There is never a fee to anyone for this service. This is all funded by the Social Security Administration. At the end of that call to the helpline, you will know that you're going to be referred, and you're going to know to what organization. So our goal is, once we receive that referral, and it does come through the same day you call, we reach out to you at least once within the first 5 business days. We need to get to you soon because people are starting jobs. I mean, that's our criteria from Social Security. So that is how you reach me. And I think I'm pretty, yep, well, cutting it a little close. But yeah, so I gave you a ton of information. Please feel free to ask questions.
Joy, we do have a couple questions, and we have some time
Okay.
before Jesse begins. So I'll go through them as quickly as I can. Do
Okay.
SSI guidelines that you are, are the SSI guidelines that you discussed applicable for all states?
Yes. Yes. The only thing that would be different, the $47,000 amount I said about Medicaid and SSI, that's specific to Pennsylvania. Each state has their own income limit for Medicaid. But yeah,
Okay.
SSI is federal.
Thank you. Thank you, Joy. What if the net earnings are either direct deposited and or placed in a Pennsylvania ABLE account? Does SSI still consider it to be reportable income to adjust their payment?
If a person is working, that is considered earnings. So the gross amount would be looked at to adjust their SSI payment. Even though you put it directly into a PA ABLE account, it does count as earnings. It won't count as an asset, but it will count as earnings.
Great, thank you. Who can help a person with a PASS plan? Is there a template or directions with what is all required?
So a benefits counselor can discuss that with you when we start the benefits counseling process. We do ask key questions to see, what work incentives are applicable to you. I can't comment on how good they are, but I do know there are some templates online that you can start the process with the PASS. It is a lengthy process, but a benefits counselor can assist you with that.
My autistic daughter will be 18 in February. When can I apply for SSI benefits?
After the 18th birthday. Doesn't
So the
matter
day after.
when, the day
Okay.
after.
Probably the sooner, and I imagine the sooner the better. As soon as she turns 18 would be,
Mhm.
I would, recommend. 17-year-old, my junior in high school with autism, would they automatically qualify for SSI? And do you help with the SSI application process?
So unfortunately, no, we do not help with the SSI application process. 17 years old, they would look at the disability. They would also look at the parent's income, the household income. If you have questions about it, I would contact the local Social Security office, or everything could be done online now. You can do the SSI application right online. And that would be a starting point.
Do these programs only apply to working above SGA? What are the rules for reporting if making less than SGA?
It's a good question. So some of them do apply if you're above and below SGA. If you're on SSI, you always have to report whether or not you're above or below SGA. SSDI, it's not super critical, but that's a little bit more too specific. I can't say exactly all the parameters. That sounds like a benefits counseling session is needed.
Thanks, Joy. Is there a way to just apply for SSI without first applying for SSDI? Our support coordinator sent us a link for SSDI to apply. I already have SSI after being denied SSDI, but thought this would be helpful for those ready to apply.
So I'm wondering why the person was denied SSDI. If they didn't have a work history to qualify, then that's probably why they got on SSI at this point. So I can't see why you would apply for SSDI again.
Okay.
I'd reach out to that supports coordinator to see what their thought process was.
Good idea. If someone with eligible disability is getting denied from initial benefits, is there someone they can turn to help outside of the main Social Security helpline?
There are advocacy groups that assist with that. Pennsylvania Protection and Advocacy can sometimes look at that. It's dependent on the case. Also too, I've worked with a lot of individuals that have hired attorneys or receive free legal help to get on Social Security benefits.
And Joy, we have had speaker programs in the past on how to appeal Social Security denials. And so I agree, there are attorneys out there that do that don't even charge up front. I think they wait to see if you get a back payment from them or not. So good questions. This again, another question about whether this is being recorded. This webinar is being recorded. I put a link in the chat, so you can access it there or just visit our website as well. If a child is 17, would it benefit to wait until 18 to apply for SSI, since it sounds like there is a transition change for benefits at 18?
I mean, there is a transition at age 18. It might be beneficial to wait, but if there is a low income situation in the household, you might qualify at 17. It can't hurt, but.
And someone wanted to know, what is SGI?
SGA.
Okay,
Is that?
they typed SGI, so but it's SGA.
I don't know what SGI is, so I can't help with that. But SGA stands for substantial gainful activity. That's the dollar amount that Social Security looks at, really pertaining to SSDI, not SSI as much, to see if you qualify for benefits. And that amount for next year is $1,470 gross per month. This year is $1,350 gross per month.
Okay. And I think that was all of them. So thank you, Joy. Your presentation was fantastic as always, and you're always a wealth of information. And I appreciate you sharing your contact information. And with those that maybe have more specific questions that you can probably help them with, or they can set up an appointment to meet with you. So great. Well, next up is Jesse Streeter from the Pennsylvania Treasury, and he's going to talk about Pennsylvania ABLE accounts. So, and Jesse, it's usually okay if we run a couple minutes early, so don't feel like you have to rush just to get done by noon. If you need to go a couple minutes after, people can hang on if they're able to.
Okay.
Thanks.
Okay. All right. Thank you for having me here today. My name is Jesse, and as I said, I am with the State Treasury, and I'm here to talk about a quick overview of PA ABLE. This is something you heard mentioned a couple of times in the previous presentations, but I'm going to give you a very brief and a very relatively quick overview of PA ABLE savings program. And we're just going to talk about what ABLE is, who's eligible, and then we're going to get into some details such as, opening the account, contributing the account withdrawals, stuff like that. But really I want to highlight some of the benefits of PA ABLE and, how it can enhance your lives here. So an ABLE account is a savings account, but it's also an investment account, and it could be a checking account as well. But if there's one major highlight that I want you to take away from this presentation, one big benefit, and you probably heard it mentioned earlier, but it does not count towards your other government benefits, with the exception of SSI up to a much higher threshold than previously known as before. And what that does, it allows individuals with disabilities to be able to save and actually accrue a savings account to make their own financial decisions. And that's exactly what this account does. When used properly, it helps you achieve a better life experience. So as we mentioned, there are government benefits, and one of those big ones is that that threshold increase. So if you're using a PA ABLE account and you're an SSI recipient, you can now save up to $100,000 before that impacts your SSI. Once you do hit that $100,000 threshold, your SSI does get suspended, but not terminated. But your medical assistance benefits will continue. If you're not an SSI recipient, you can actually save up to $500,000 in the ABLE account. Along with the higher threshold benefits, there are tax benefits. For now, it is $16,000 per person per year. As far as tax deduction from state income taxes. Next year it switches over to $17,000. But if you are a contributor to a PA ABLE account for that tax deduction, and it has to be into a Pennsylvania ABLE account for Pennsylvania income tax deduction. There are several ABLE accounts throughout many states. So if you're a contributor, make sure it goes into a Pennsylvania ABLE account in order to get that benefit. Like I did say, it is an investment account as well. So you are more than likely to accrue earnings, whether it's interest or capital gains. You will most likely accrue earnings, and those earnings are tax deferred. and they're income tax free, both federally and state, when you make those withdrawals, and use them for qualifying disability expenses. And we're going to get into those qualifying disability expenses here later on in the presentation. So who's eligible for an ABLE account? Well, really, there's two criteria that kind of go into deciding eligibility. And the first one is the age of the onset of that disability. For a lot of disabilities do come with birth, but if you acquired a disability later in life through an accident, whether it's a car accident or work accident, that accident has to have happened before your 26th birthday. As of right now, we are very hopeful that Congress will increase that age limitation. Hopefully relatively soon. It is on the table, and like I said, we're hoping that it gets raised somewhere in the 40s, but for now it is at 26th birthday of the accident. That's a real important factor, because accidents could leave a lingering effect that really don't have a great impact on you until later in life. But as long as that accident that caused that underlying accident that caused that disability happened for your 26th birthday, you have met the first criteria. The second criteria is the disability itself. The disability does need to cause a severe functional limitation. And to decide whether that disability qualifies or not, it's quite simple. There's two ways. First one, if you are a recipient or are eligible for SSI or SSDI, you're automatically qualified. Otherwise, you can do a self-certification. Self-certifying is actually pretty easy. All you really need is a written diagnosis from a physician that does state that you are suffering from a disability that does have severe functional limitations, and that limitation is expected to continue for at least a year. All right, so now that you met those eligibility requirements, and you want to open an account, we do find it is most people like to use the online version to open an account. It's quite simple. If you go to paable.gov, you'll see a tab right there in the front page for enroll. Click on enroll, and it will walk you through the steps to open an account. It is a financial opening, so it does take a few minutes. Expect 10 to 15 minutes while opening this account. And I do want to point out, though, when it says your name, that is the account owner. All right, you might be an authorized individual opening an account for someone else, but when it says your name, it is the account owner, which is the person with the disability. If you are over the age of 18, you have the legal capacity to enter into contracts, you can open the account yourself, but you don't have to. If you have an authorized individual that you want to open it on your behalf, you're more welcome to. But if you're under the age of 18, you do need someone else to open it up on your behalf. And the list of priorities of who qualifies as an authorized individual is right here on this slide, in that order. So that's the order you need to follow when you are opening an account on someone else's behalf. So now that we've opened the account, it's time to fund it. And you can fund these accounts in the traditional manners. You can either make payments or move money online. You can deposit a check, money order, or even have a payroll deduction similar to direct deposit. Or anyone can make these contributions as well. Friends and family can make a contribution to someone else's ABLE account, and the person whoever's making those contributions do benefit from those tax deductions. Again, like I said, at $16,000 this year, $17,000 going into next year. And now you have money in the account. It's time to put it to use and make withdrawals. You can use it if you're on the savings side or the investment side. You can withdraw via online or by phone. You can even write and have those withdrawals. But if you're using the checking account, it operates like any other checking account. You're going to get a debit card. You can sign up for checks and write checks. You can use those debit card as a point of sale at the store, or you can use it at an ATM withdrawal. But if you want to truly maximize the benefits of this account, make sure you use them for qualified disability expenses. And the federal law has given about 11 categories as to what qualifies. So if you are making a purchase and you want to make sure it does qualify under one of these categories, and if you're not sure, just hang on to that receipt just in case there's an audit and you need to make a justification. But otherwise, it covers quite a bit. And I can't get into specifics as to exactly, what counts, what doesn't count. Like I said, if you feel it counts as something required for your disability expense, make the purchase, keep the receipt, and just in case you need to make a justification. So as I mentioned, this is a very brief, high-level overview. We didn't get into a lot of details, but tomorrow there is another webinar on our website, paable.gov, and it's from 10 to 11, and it should be saved. And it's an hour-long presentation from one of our experts that will dive really deep into the details of this program. So if you have any questions on that, you can watch tomorrow's webinar from 10 to 11. You can also jump on the website at any point, paable.gov. There's a lot of good material there to look over. And of course, I'll be here for a few more minutes to answer any questions that you might have.
Thanks, Jesse. There were a couple of questions.
Sure.
Does Pennsylvania Able have a list? Does Pennsylvania Able have you list a beneficiary should something happen to the account holder?
Do they have a list of beneficiaries? As if I'm not
Do
sure
you
if I
list a
follow- I'm sorry.
beneficiary should something happen to the account holder? I think they're trying to ask what happens to the money if something happens to the account holder.
Gotcha.
So do you
Yeah.
have to list a beneficiary of who would receive the remaining funds?
It would fall under the individual or the authorized individual if there is one. Otherwise, it would fall under the estate of the individual.
Okay. What bank or financial institution holds the ABLE funds?
Fifth Third, actually. Fifth Third Bank.
Okay. And I also put up a link in the chat for the Pennsylvania ABLE accounts. So, if someone's in chat right now, they can link on there. Can you go back to the categories for which you can spend in the account?
Sure. Let me share my screen real quick. I'll go back to that slide. All right. All right. Can you see that slide okay?
Yes, I see it.
Okay, yeah. So there's 11 total. The federal law has listed, and if you take a look at it, you really see that. I mean, a lot of things qualify. You can use the account for literally anything, but to maximize those benefits, try to make sure it falls under these categories. And if there is a question, just save the receipt. Save the receipt, and if there's an audit, they'll help you make that determination and make that correction if it was used incorrectly.
Another question, Jesse, what housing limitations would there be? Assume rent is okay as an eligible expense.
Okay, if you're assuming that, what housing limitations? I'm not sure if I understand that.
Yes, what housing limitations are there any limitations on, it just says, what housing limitations would there be?
There isn't.
Assuming,
No.
okay,
There
so
isn't. That's the
assuming
nice thing
rent,
go ahead.
rent is okay as an eligible expense then, okay.
Yep, like I said, I'm not allowed to really tell you exactly. If you give a specific question, I can't say yes or no. If you see these categories, like I said, it can be used for anything, and it's up to that individual to decide whether it is necessary for disability expense. And if there's a question, just hang on that receipt, and then if there's an audit, they'll just simply say, this wasn't quite used correctly, and we're just going to, remove it from your deduction. It's not, no one, gets hauled off to jail for an incorrect usage. It's just hang on to those receipts just in case. But otherwise, it's up to you to decide if it's necessary.
Can money and ABLE be used for buying a car?
Again, falls into that same category as to, do you feel that it is necessary? And that's one of the nice things about this benefit, about this account, that you are able to save enough money to where you can actually buy a car if you need to. So yeah, if it falls under that category, and I'm looking at some of these categories right now, and it looks like it possibly could, but again, I'm not the one to be able to say that. So buy it if you feel it's eligible. Purchase it as it is eligible, hang on to that receipt, And if you can justify it under an audit, it shouldn't be an issue.
Is there a year-end document sent to do taxes at the end of the year?
I believe there is, and they're actually making a couple of changes this year. So you can find that information on the website, I believe. And again, tomorrow is another webinar that really do a deep dive into all those small nuances there.
Are there any fees to have an ABLE account? If so, how much?
It is a free account, but there are some small fees depending on what you're getting into. Like for instance, you might need to buy checks, and there is a cost to buying checks. There is some maintenance fees on the investment portion of it, none of them very high. Again, the checks, even if you're buying checks, it's small, it's like $6. And that list of fees is on that paable.gov website as well.
There's a question here, and is it still true once a person with a disability passes away, the leftover funding goes back to the government? There was a rule in the very beginning, but wasn't sure if it changed.
That one I'm not familiar with. Diana will be on the webinar tomorrow. She can answer that question. But if you leave that person's information, I can get that for you later today.
Well, Jesse, I think I can answer that question. No, when a person
Yeah.
with a disability passes away, the money in an ABLE account will go back to whoever they have requested that it go back to a non-disabled sibling. There are some states with ABLE accounts that do require Medicaid to be paid back. Pennsylvania at this point is not one of them. So any money left over in an ABLE account in Pennsylvania goes back to whoever the account owner signifies that it should go back to. So I hope that answers the question, but that was never the case in Pennsylvania, that the government was paid back. Other states do require Medicaid to be paid back.
Yeah, I would not imagine that the money in it would go to anybody else but someone within the estate.
And are there any year-end documents sent regarding for taxes?
Yeah, there will be a mailed out portion of the letter that the recipient should be able to receive, or go online and be able to receive as well.
Okay, great. Okay, well, thank you very much. That was the last question. I really appreciate your time, Jesse, and I really appreciate the time of all the presenters here today. This was a lot of good information, and let me just share something. I want to just put up our contact information if possible here at Achieve a Family Trust, because we are happy also to answer any questions. There were a couple comments that came up at times, where it was Aaron or Joy mentioned perhaps reach out to Achieve a Family Trust. They might be able to answer that. And we are always happy to answer any questions that any of you may have regarding special needs trusts. And we work closely with the Pennsylvania Treasury on ABLE accounts as well. They're really both great savings tools and ways to shelter assets. So we're happy to help you anywhere we can. Let me see if I can pull up. Oh gosh, I've had trouble with sharing my screen sometimes because I'm not sure. There you go. I'm not sure. Hopefully this will pop up. I've put my contact information up there. Joy or Aaron, can you give me a thumbs up if you see our contact information? No, I'm not seeing it on our end.
It's trying, there it is. There you go.
Okay, it's up now. Thank you so much. But you can please feel free to reach out to myself. Again, I'm Patty Urena. My colleague Maria Smith is also on this webinar today. But here is our phone number, our email addresses. We're really happy that so many of you can join us today, and so many of you stayed on for the whole 2 hours, even a little over that. But again, I want to remind you, this is recorded. It will be put on our website by the end of the week. I'll share the PowerPoints from the presenters as well. And again, you can always visit our website to learn more about Achieve a Family Trust, what events we have coming up, what speaker programs we're going to be doing in 2023, and also to sign up for our newsletter, because that's where we promote a lot of these events. So I thank you for your time today. And again, want to thank Joy, Aaron, and Jesse. Thanks so much.
Thank you for having me.
Bye-bye.